I rise today for all Hoosiers who have been touched by addiction or suffered the loss of a loved one as a result of opioid abuse, heroin use, or other drug epidemics. I'm here for every Hoosier community that has been gripped by addiction. I'm here for Austin, Indiana, small town of 4,200, much like many small towns in the President's home state of North Carolina. But in Austin, more than 185 people tested positive for HIV, largely caused by injection drug users who shared needles. I'm here for Connorsville, which was devastated by a heroin epidemic that saw 41 overdoses and 8 deaths in a 3-month span. I'm here for my hometown of Granger, which was shaken last year when 2 teenage brothers, Nick and Jack Savage, died in just one night from a prescription drug-related overdose. I'm here for Fort Wayne and Lafayette and Terre Haute and Indianapolis and every community across our state. No part of Indiana or our country is immune from the pain of addiction and these drug epidemics. By now, many of us have heard the staggering statistics. One person in America dies every 25 minutes from an opioid overdose. And overdose deaths in the United States now outnumber fatal auto accidents. Ultimately, this is about people. People like Mike Zoss of Tippecanoe County. Mike was the youngest of 3 boys. Mike's creative, enjoyed reading, had a ton of friends. In high school, he began experimenting with prescription drugs. During his senior year, Mike's mom, Donna, got a call no parent wants to receive. Mike had overdosed at a friend's house from a combination of Lyrica and methadone. He landed in intensive care and was in a coma for nearly 3 weeks. Miraculously, Mike survived. But after struggling for nearly 3 more years with his addiction, Mike died from another overdose. This scourge is about families and the heartbreak they endure, and all the people whose lives are shattered by addiction or even cut short. It's why I've been working on this issue for over 2 years, listening to Hoosiers, introducing bipartisan legislation, partnering with federal and state and local officials, and bringing stakeholders together. And these families are why I support the Comprehensive Addiction and Recovery Act. This bill provides states and local communities with the tools to prevent and treat drug addiction and to support individuals in recovery. CARA strengthens prevention efforts, increases access to treatment and recovery services, develops best prescribing practices, and expands access to naloxone, also known as Narcan, which can reverse the effects of an opioid overdose. In addition, CARA expands disposal sites for unwanted and unused prescription drugs to keep them out of the hands of children and teens. And CARA strengthens prescription drug monitoring programs. This bill provides states and local communities with the tools to prevent and treat drug addiction and to support individuals in recovery. CARA strengthens prevention efforts, increases access to treatment, develops best prescribing practices, and expands access to naloxone, as I said. Naloxone can reverse the effects of an opioid overdose. These are incredible steps that can make a huge change in what happens in the future of our country. And while this bipartisan bill includes many important provisions that helps families in my home state of Indiana and across our entire country, it will take all of us working together to prevent and treat addiction. Prescribers and pharmacists, law enforcement and first responders, parents and families, and officials at the federal, state, and local levels all have a role to play. I want to talk to you today about how CARA can best help in these efforts. First, prescribers. Our prescribers play a vital role in addressing addiction because they are our partners in the fight to reduce the risk of prescription drug abuse. They have the knowledge and authority to help patients, our friends, our neighbors, our family members understand both the benefits of prescription opioids and the potentially devastating dangers associated with opioid abuse. Last year, we hosted a roundtable discussion in Indianapolis on prescriber practices with my colleague, Congresswoman Susan Brooks. By bringing together state officials, doctors, pharmacists, all of them playing key roles in curbing overprescribing, we can better engage health professionals in the fight against the opioid epidemic. We want to make sure doctors have the training, the tools, and the resources to prevent overprescribing, and also to help them make the best possible decisions about how to treat their patients. Right now, there's not one set of current nationally accepted best practices that can help prescribers make the best informed decisions about prescribing these opioid drugs. And existing guidelines vary in the recommendations that are made. CARA helps. It includes a provision adopted from my bipartisan legislation that I reintroduced last year with my friend and colleague, Senator Kelly Ayotte from New Hampshire, which brings experts together to review, to modify and update, where necessary, best practices for pain management and prescribing pain medication. Second, I want to talk about our first responders and our law enforcement, who are on the front lines of this crisis. Frequently, they're called to scenes where an individual has overdosed, and they are working to find ways to address these drug epidemics. In Northwest Indiana, the Porter County Sheriff's Department is reaching out to educate families about the heroin crisis there with a video that includes first-person accounts about how the epidemic has impacted the local community. And in the northeast part of our state, over by the Ohio border, the Fort Wayne Fire Department began using Narcan just last August to try to help save people who had overdosed. In the first 4 days, they had to use it 3 different times, and many times since then. In central Indiana last year, Indianapolis EMS administered naloxone an astounding 1,227 times. Over 1,000 times. We need to make the overdose reversal drug naloxone more readily available to first responders and law enforcement. CARA includes a provision similar to one from my bill with Senator Ayotte that provides grants to train law enforcement and other first responders in the administration of naloxone to save lives. I've also offered an amendment that encourages first responder units receiving funding through this program to use outreach coordinators to ensure every individual who receives naloxone also receives in-person follow-up. Indianapolis EMS recently began a similar outreach program designed to connect overdose victims who receive naloxone with the help they need. CARA assists law enforcement by expanding resources to identify and treat individuals facing addiction in criminal justice settings. I hear frequently from my friends, the police officers, sheriffs, judges, and court personnel throughout the Hoosier State that more resources are sorely needed. Third, I want to talk about families. There are countless personal stories across our state and almost every state of moms and dads, brothers and sisters, wives and husbands, and grandparents who've been impacted by this addiction. I just want to share a couple of these stories. Our young friend, Aaron. Justin Phillips remembers her son, Aaron, a talented athlete, dreams of playing football in college and the NFL. Starting quarterback on Lawrence North's varsity team, smart, charming, generous heart. It started for Aaron with a prescription pain medicine and then led to heroin. At the age of 20 years old, in October 2013, Aaron died of a heroin overdose. His mom said, "We can't pretend it's not our kid," because it very well may be our kid. Who's next? And there are people like Michelle Standiford of Lebanon, Indiana, who lost her son and her nephew to addiction. Her nephew, Greg, died 3 years ago from a heroin overdose at the age of 21. And her son, Troy, 33, died following a long battle with addiction. His struggle began when he was prescribed opioids for a jet ski accident, for the pain he was struggling with. This past Christmas, Michelle visited Troy, who was in South Florida seeking treatment. She said he was in great spirits and eager to reunite with his family. But a few weeks after Troy came back home to Indiana, he passed away. Think of this. He left behind parents, a wife, 2 sons, 2 and 4 years old. These stories are way too common. As Donna Zoss of Lafayette said, there are way too many kids dying, and as a community, we need to do something about it. She wants to make sure other families learn from her experience before it's too late. Cara helps families by raising awareness about opioid abuse and heroin abuse and expanding access to treatment. It includes a provision from our bipartisan bill with Senator Ayotte that establishes a national drug awareness program. By helping families learn about the serious effects of opioid abuse and its connection to heroin, it can make a difference. CARA strengthens additional prevention efforts and increases access to treatment and recovery services with the goal of helping more people overcome addiction, and that includes specific initiatives for women, youth, and vets. Mr. President, we're not doing enough, and the burden of addressing the opioid abuse and heroin abuse epidemic has fallen heavily on our criminal justice system, which is clearly not equipped to treat all those struggling with addiction. That's why CARE is so important and why we need to pass this critical legislation quickly. We have an opportunity to work together, all of us, to pass a good bipartisan bill that helps confront opioid abuse, heroin abuse, and other drug epidemics. On the federal level, it's our job to support and strengthen partnerships on the state and local level to make sure every town in every state is accounted for and can heal. CARA will do just that. It's a significant step forward, although I think we can all agree that it's just a first step. Mr. President, I yield back.